Thank you all for coming. I wish all of you could understand my happiness right now. It's such a great honor to be one of this year's recipients of the Hyundai Hope on Wheels Young Investigator Award. If years ago someone would have told me that I was going to win this prestigious award and have a private ceremony at MD Anderson Cancer Center with the presence of my wonderful family, including my 80-year-old grandfather who flew in from Peru, I would have not believed it. On behalf of all our clinicians and researchers in the Division of Pediatrics, our patients, families, and friends at MD Anderson Children's Cancer Hospital, I thank you for this generous gift that will greatly contribute to our pediatric cancer research program. My research team and I proposed the need to accelerate drug discovery in childhood cancer, specifically for Ewing sarcoma, the second most common bone tumor in children. Why don't we stop for a minute and think about how drugs are discovered? This is how it usually starts, and more importantly, this is as long as it takes. Let's start. John, a prominent researcher, suddenly discovers a dangerous protein that promotes the growth of cancer cells, and he certainly wants to stop it. He knows that if a medication is created to eliminate this malignant protein, and of course works well in patients, he could cure that type of cancer. John grabs the phone and immediately calls a pharmaceutical company. He requests them to make that promising drug to stop those cancer cells from dividing. After some months, he suddenly gets a shipment of this novel formulation to his lab. Excited, he first tries the drug in plates with cancer cells, just to see if it truly works or not. After several months of hard work, repetition, and thorough analysis, his results look pretty good. All cancer cells in plates are gone. John is super motivated. Who wouldn't? But he still needs one more step before trying the medication in patients. He first needs to try them in mice, and that usually takes a little bit longer. After numerous months of hard work, repetition, and thorough analysis, results look even better. Tumors in mice have disappeared completely. John is absolutely ready to try the drug in patients. This is it, he's feeling it. His dream will come true. This time, he needs more planning. Of course, he will need leaders of the medication, he will need doctors, he will need nurses, labs, biopsies, imaging, hospitals, etc. After long months of trial, and perhaps years, he finds out that this drug did not work in patients. What? How could that happen? What went wrong? Everything was looking great. Well, unfortunately, plates with cancer and mice are not always predictive of what could happen with patients. Many years of work spent, resources, and more importantly, patient lives. So is there a better way to see if a drug will work in patients? Not quite. As scientists, we just need to press the reset button and start all over again. Our project, done in collaboration with MIT and Harvard University, bypasses this obstacle and instead attempts to find out in 24 hours if a drug would work in patients or not. For this, we will use tiny microdevices loaded with different drugs and assess within the same human patient tumor for their local effect. We hypothesize that this local effect will be a better predictor of global tumor response to a specific therapy, hopefully much more accurate than plates and mice. I believe that in the near future, we will be able to take more drugs into trial with greater result reliability without wasting time, without wasting lives. I am profoundly grateful to Hyundai Hope on Wheels for their support of this exciting research project. Thank you so much.